My name's Katie Mack. I am the eSmart project director. eSmart is an early childhood system of care grant that was awarded to the Carroll County Health Department. So I have very close relationships with many of our early childhood partners in Carroll County, as well as adult service providers in the community, because we really look at serving the whole family. I believe in this campaign for multiple reasons, but I think the most important is really recognizing that everyone has mental health. We shouldn't only be focusing on, when challenges might arise or when a crisis might arise, but really promoting at the most basic level. So encouraging children's mental health from the very beginning, at the very earliest ages. More recently, some of the activities that we have held through Children's Mental Health Matters Week, we started partnering actually with our Carroll County Public Library branches, and we held story times. We really appreciated that venue because those are really the hubs of our communities, and they're safe spaces for families. So we held story times at each of those library branches. That was, of course, pre-pandemic, when we could hold activities in person. We had different books that were read throughout the week that focused on mental health. And then we also made sure that families left those events or activities with resources and information. More recently, with the pandemic, we found that a lot of families really appreciated those story times, and we held those virtually. So families could access them a little bit more easier. They didn't have to make sure to get to a library branch at a specific time. So they could watch them on their own. They could watch them with their child. And it just encouraged early literacy as well. And just a fun activity for families to engage in. Campaign has really helped to encourage families to feel comfortable and confident in reaching out when they're having concerns. So it doesn't have to be a scary conversation. It doesn't have to be a stigmatizing conversation. Again, just encouraging families when they are seeing warning signs and symptoms that they know where they can reach out to, having those outpatient mental health providers or crisis hotlines available. These conversations should take place each and every day, but the week of the campaign really gives us the opportunity to kind of hone in the efforts of making sure that our community is aware of the resources available. Children's mental health is important to me. One, because that's, kind of my job and my role. But I have kiddos in my life. Again, encouraging mental health at the earliest age possible to prevent mental illness, to prevent, other risk factors from happening. People should get involved in the campaign because we do this work each and every day. And it's an important week for us to celebrate the work that we do. Make sure, again, that families have the information available when a crisis might happen, or, just promoting at the most basic level children's mental health.